Welcome back to the Changemaker podcast. I'm your host, Deke Copenhaver. Today, my guest is Max Mayblum. He is the founder and CEO of Givers. Motivated by his personal experience with family caregiving and his background in health tech, he started the company on a mission to help caregivers get long overdue support and resources. Max is a certified senior advisor and is passionate about helping caregivers find joy and connection in their role. Max is also a graduate of Emory and in 2023 was recognized by Forbes magazine as a member of their 30 under 30 list. Ladies and gentlemen, let's welcome Max.
Welcome to the Changemaker podcast, hosted by Deke Copenhaver. Deke is the author of The Changemaker, a Forbes publishing book that has reached #1 on Amazon on multiple occasions and in multiple categories like management skills and total quality management. During this podcast, Deke interviews exceptional change-making leaders. Deke currently operates Copenhaver Consulting, where he helps local governments and other public organizations maximize their potential. He's also a sought-after public speaker. We hope that the Changemaker has an impact on you today and that you find takeaways that make you a better leader in your life. Now, here's Deke.
Thanks for having me, Deke. Excited for the conversation.
Yeah, man, I just want to dive right into it. I've thought about what you do, and I appreciate so much what you do, but so tell us a little bit about what Givers does. But I think necessity is always, the mother of invention. And it sounds like that was the case in your situation.
Yes. So let me give you a little bit of background. So I've been in health tech for most of my career, really building digital health solutions. Prior to starting Givers, I was working as an employee at an early stage startup that was building telehealth for chronic conditions and really helping lower barriers to accessing great care in rural areas. And during COVID, I moved in with my family like so many others did at the time. And unfortunately, my aunt was diagnosed with terminal cancer. And I saw my parents kind of put their entire lives on hold and make caring for her their #1 priority. So they got in the car from Florida and drove up to Georgia where she lived. And they were there nonstop. And I wanted to do whatever I could to support. And so I was on the internet looking for different solutions for cancer treatment, for caregiver support, for financial resources, anything that might be available to support my family and them in caring for my aunt, and then also my aunt through her journey. And what I realized was there is a really broken infrastructure of systems and support for family caregivers. And it was really day and night between what I was doing during the day, which was creating this really nice, easy to use, accessible healthcare experience. And then at night, looking for solutions for my parents as caregivers. And I found, 404 pages, broken links, government websites that were hard to navigate. And I just became really motivated to build something that could help support family members who are taking care of loved ones. So just fast forward to where we are today. I started Givers 3 years ago. At Givers, we hire, support, and pay family caregivers. So we really create a structured framework for family members to provide care to their loved ones and be able to sustain that over the long term.
And that's, so I'm a common ground guy. I always seek common ground. And one of the things that I've found, so I'm 56, and my wife and I both lost our parents a little earlier in life. But at one point, we lost her mother in 2005, actually the first year I ran for mayor. But she was the primary caregiver for her father, for her aunt, and for her sister who was special needs for literally 10 years. So I saw the struggles that my wife went through. My father was diagnosed with Parkinson's in 2001 and passed in 2009. So the caregiving there, but this is a common ground issue, particularly with my friends, and as baby boomers continue to sort of get older and reach retirement age, but almost everybody I know, pretty much everybody I know whose parents are still in life are dealing with that issue, just providing care for their parents.
Yep. Yeah, the Rosalind Carter, the former First Lady, has a great quote. She says there's 4 types of people in this world: those who are caregivers, those who will be caregivers, those who were caregivers, and those who will need a caregiver. care is all around us. It unites us. And I know, Deke, you come from a political background. It's one of the most bipartisan issues that we
Yeah.
have today because everyone will experience it. Today in America, there's 53 million people taking care of their loved ones. And so for a long time, it's been this really sort of under-discussed underbelly of healthcare where family members are quietly taking care of their loved ones in the shadows. And, we would think about what's happening in the doctor's office or in the hospital, but 90% of the care is happening at home. And who's delivering that care? It's usually the family member, right? And so I think COVID was really a big paradigm shift. People moved out of assisted living facilities, moved out of institutional settings, back into the home where they could be safe. Family members were providing that care. They were on Zoom at work and they had, their loved ones in the background who they were taking care of. And all of a sudden, front and center is how care impacts everything that we do and how it's so prevalent in our society. So I'm really excited about sort of where I think society is going, where we all are going from a culture standpoint around care and just acknowledging this.
I've got a coaching client. I've actually got a session with him tomorrow, Deke. He's the CEO of AG Roads, which is an assisted living, a nonprofit assisted living group in Atlanta that they provide great care. He came on like during the height of COVID. So to see what he had to deal with, dealing with the families of, loved ones and people that were their residents. But to me, and that's great because it provides care for people that otherwise might not be able to afford quality care. But the rural areas you just mentioned, thinking about that, I came through cancer last year and we've got the Georgia Cancer Center here in Augusta. We've got a bunch of hospitals, but I'm like, what about the people, whether it's, needing caregiving for families or cancer care or whatever, but the rural people just, there's something we've got to do and you're doing it effectively.
Yeah, I think especially in rural areas and across the entire U.S., there's very clear statistics, which is that we're facing a huge direct labor shortage. So it's very, very difficult to find professional care now. You've got the population over 65 in the middle of doubling.
Yeah.
And then you've also got the rise of chronic conditions and other diseases. And so family members are just continue to be the ones pushed into this care ecosystem to do all of that work. And so I agree, especially in rural areas where there's, very few options for direct care, family members are really the only option.
And it's so interesting to me because I've got such a strong connection to your generation of folks on a lot of levels. I mentor a whole lot of young people, but so often people are like, oh, Gen Z, they're lazy, blah, 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 all the labels that every generation gets. But I'm like, no, I think that Gen Z are going to be the ones that really lead this country to a better place because they're innovative, they're connected. What you've done here is just another example of that. And the thing that I love about it is that it was really driven from your heart. It was driven from understanding what people go through in these situations. So I'm like, I was telling my wife and a friend about it last night, a friend who actually just lost his mother. He had to take care of her for a long time. But I said, that's what I hope he's wildly successful. But at the core of it, I don't sense that it was ever about, well, hey, I'm going to do this because there's a need and I'm going to make millions and millions of dollars. There's a soul and a heart in what you do, which I love.
Yeah. Well, first of all, I've always been an entrepreneur sort of through and through. As in high school, college, when I started in consulting, I was always building things on the side and tinkering. And then when I learned about the opportunity to make an impact through working in healthcare, I got really excited about really alignment to mission and being able to provide people just sort of better lives. And I always said to myself as an entrepreneur or someone who I wanted to be an entrepreneur, I always said I'm never going to go all in until I know that the mission is in the right place. That was going to be the number one thing for me. The other thing I'll say about this business is that it's truly a win-win-win. There's three major stakeholders that we touch. The first, of course, is the caregiver. The caregiver we get to provide with support, training, and also compensation to allow them to actually sustain providing care to their loved one. The care recipient is the second person. Of course, they benefit when their family member can show up for them every day and really bring their full energy focused on providing care rather than how are we going to make the next paycheck and pay the next bill, right? And so that definitely is the second beneficiary. And then the third beneficiary is the state. We've had a huge ballooning of long-term care costs in this country. And this program has a ton of amazing data around cost containment and showing that we can provide lower cost care in the home setting where many people want to be anyway, and provide that benefit to the state where we're improving outcomes and we're also improving the cost of long-term care.
It's interesting. So when I was first diagnosed with cancer, people started giving me, I call them tchotchkes. I mean, just little coins and crosses and all this. And so I'm like, well, man, I need to get something to give people. So I keep running out and they're hard to find, but coins that have St. Raphael, the patron saint of healing. So I give them to cancer patients, I give them to doctors, but I've started bringing on clients who are actually mayors. And so I've started giving them to them because I'm like, okay, mayors should be in the business of healing your community. And I've got a lady that's coming on with me. Her name is Peaches Barnes, and she's she was just elected in the Democratic primary in Florence, South Carolina, has no Republican opponent in November, but she's also a minister. And so her first meeting with me, she said, when I talk about leading the city through love and compassion, people look at me like I've got two heads. I'm like, no, Peaches, that is what I did for 9 years in office. It works, but as I say, I see common ground. I mean, everybody has had a family member themselves or somebody they know that's been impacted by cancer. I mean, pretty much everybody. But the issue that you're dealing with, as you say, it should be totally bipartisan. But I'm like, all these, these vulnerabilities that we all share should build bridges of compassion and empathy. And I think, as I say, I want you to be wildly successful, but I can see, where your heart is on this. And we need more political, business, and everything leaders that have a true heart for service.
Yeah. I mean, human first, right? We need to just get to the roots of why we're doing this and trying to serve people. And at the end of the day, the thing we always think about at a company is that we want to treat people how we wanted our own families to be treated. Everyone who works for Givers has gone through a personal caregiving experience. And that's a really important piece of our culture, is that we've all been there and we all know the things that people face. And one of the things that I would say around sort of being human is that we all have kind of, I think, unified our vision around is that care itself is not the burden. It's all the other things that surround care. When my aunt was sick, I know there was nothing more that my family loved doing than being in the room and sitting on the chair next to her bed and being there with her. The things that we didn't like doing were where we had to step out of the room and we had to make the phone call, or we had to look up the insurance thing on the portal that's so clunky. And so what we do at Givers, I think, is really focused on allowing people to be in the room and taking away all the burden that happens outside of the room.
And so many people. So fortunately, we were able to get in-home care for my father for 8 years, and the same thing for my father-in-law. But not everybody, but so many people, if they have a choice, would prefer to remain at home because, dealing with my coaching client, they've just done a new model with AG Roads with sort of pods where people are not moved around and it's more like a household. But it's just, if you can stay at home, it's familiar. It's where, it's a place that you feel like you belong and that you have been there for years. So talk a little bit about that. I would say that it would feel good to be able to provide that service to keep people at home if that is what they really want to do.
Yeah. AARP has a great study that shows that 90% of people over 50 say that they'd prefer to age in place over time, right? So I think it's a long-term trend here where people want to remain in the community that we're seeing. The other thing around familiarity that I would double click on is not only do they want a familiar setting, they want a familiar person.
Yeah.
Right. And so direct care is great. You can bring in professionals who've been there before and they know what they're doing. But in some cases, you want that cultural competence. You want someone who knows the dinner that I love. You want someone who knows how to, rub my back when I have a headache or whatever it may be. Right. And so the family member is obviously the most familiar. And that's also what I think is so powerful about this program and how we support and pay family members, is that it allows the family member to show up as the professional caregiver so they can have both sort of the familiarity of being in the home, but also the familiarity of having a loved one take care of them.
It's funny. A number of years ago, my wife said, what you do, everything you do is a ministry. And I said, I think that that's a good way to look at it. My time in office was nothing about politics. But I've told my wife, this is a joint ministry. So my wife has the biggest heart of anybody you've ever seen. But we have a lady that's been with the family for years and years and years. And she's in her 70s now. But so to keep her with, we don't ask her to do too much around the house, but she is an amazing cook. And so cooking for two people, you always have. So I'm like, Melissa, this is your food ministry. So people that we know that live at home, that, a lot of them's kids don't live in Augusta. A lot of them are, have lost a loved one, but she constantly provides food to these folks. And it brings joy to our heart, but it's just those little things. It's like during COVID, somebody said, well, what can I do? I said, well, because I feel so powerless. I said, everybody that lives alone, you can call them, you can just stop by to see them, and you can check on them, because that we have a epidemic of loneliness.
Yes, loneliness. They say is like smoking a pack of cigarettes a day. It's very unhealthy for you, and being able to provide I guess the infrastructure really to have family members show up every day is really what's important, because in so many cases, people are making that tough call, right? Should I go to work every day so I can pay for the food and bring it home onto the table?
Yeah.
Or should I stay at home and be there for my loved one? And this is the dilemma that people are facing. We focus on the Medicaid population, right? So we're working with some of the most low income, vulnerable families in Georgia, where these trade-offs are critical to making the bills at the end of the month or getting the food on the table. And so being able to have that choice to say, you know what, I'm going to stay home so mom isn't alone, or mom doesn't have to rely on someone she doesn't trust or doesn't get along with, and then also I can get paid for this. It allows you to kind of continue those pieces of your life that you need to, not derailing your financial plans, but also allowing you to show up at home.
So I've got a good friend who's a best-selling author out of Austin, Texas, Scott Mackey. But we've put in a proposal for a panel at South by Southwest, a radical idea: love, politics, and winning elections. So I think we're both on the same page as you can do that. But he's at Burning Man right now. I couldn't go, but we're like, it's the lack of connectivity on so many levels in society that I think really is causing so many problems. And I've thought about it. It's like, when you think about these enclaves of extremely wealthy people, and good for them, but if you live in that and that's your lifestyle every day, you don't have the interactions with the people that you're dealing with, and see the conditions that people that are living in abject poverty, that are having to put food on the table. They're having to take care of loved ones. So to provide that service, and to me, it's always my greatest passion is engaging the next generation of leaders, but it's also trying to find ways to minister to the least of these, the people that, that have a lot less than what we often take for granted.
I agree with that. Yeah, we see a lot of tough situations, and at the end of the day, people want to show up for their loved ones, whether they're in the highest income bracket or the lowest income bracket. And so the question is, how can people who are in the lower income bracket do that? And this is an amazing program. So the way it works is it's a government sponsored program through Medicaid. So we help people actually enroll in this program and find out if they're eligible. Essentially, they can come to our website, which is joingivers.com. They fill out a very quick questionnaire. It looks kind of like a TurboTax. We just learn about them. We find out where they live. We find out who they're taking care of, the situation that they're in, their income level. And then what we do is we've actually mapped the entire country for every program that exists to support family caregivers. And so we're running a really sophisticated algorithm on the back end to figure out what programs you're going to be eligible for. And so instead of the experience that I had with my own family, where I had to Google and scroll to the fifth page and find what's there and read these long blogs, you can answer 7 quick questions, tell us who you are. We're going to give you a very personalized recommendation, and then we'll tell you how to get to the front door and start applying. Here's the phone number you need to call and the extension you have to dial. Here's the URL you need to go to. And then in the state of Georgia, we actually hire, support, and pay family caregivers. So if you come through that TurboTax-like program of ours and find out that you're eligible, what we'll do is we'll give you a call. We'll help you apply with the state for this program, and then go through the enrollment process over the course of maybe 30 to 60 days. And once you actually get enrolled, we'll hire you to our agency. So you can think of Givers a little bit like a home care agency, except the only people that we work with are family members. So our caregivers are family caregivers. Once they've been enrolled, we provide them with professionalized training, support. They have a coach that's available 24/7. And then we also provide them with a financial stipend so that they can continue to sustain the care.
I've got so many people that are friends of mine here in Augusta that I'm like, I've got to hook them up with Max. But so how many states are you in now, or what is your, projection for the future? I mean, I would say it's a huge growth market.
Yeah. So every single state, especially coming out of COVID, started to offer some program like this. Medicaid is a complicated system. So Medicaid, for many people don't even know the difference between Medicare and Medicaid. That's how I started in this business. Medicare is for older adults. Medicaid is for lower income people, and Medicaid is operated at a state level. So there's federal rules, there's federal funding, but every state decides how their own Medicaid program works. So each state during COVID started to offer a program like this. The programs look a little bit different, but we see that, coming out of COVID, every state has continued to fund these programs because they're showing great outcomes, they're showing great cost containment, and people love them. And so I think the tailwinds are really behind us by way of sort of as care continues to evolve, our population ages, family members continue to play more of a role. These programs are going to get bigger and bigger. So our goal as a company is to become a national brand. That's why we were so, I think, upfront in investing in building this national database of every single program. So no matter where you are in the country, you can come to our website right now and find a program. In some states, we may be able to actually provide that training, support, and payment. But in others, we may just provide you with sort of the most direct path to applying for a program. So we really like to try and be, I'd say, as sort of nonpartisan or as non-biased as possible. We want to provide you with the right angle to support. If you're in a case where we can provide that support to you, that's great. And if not, we're going to give you really just the most direct route to finding what you need.
It's so funny. As I say, as a former politician, I'm happily independent, but it's like we tend to politicize everything. And this, to me, as you mentioned, bipartisan support, I'm like, I don't know how you politicize caring for aging citizens. I just don't. There's probably somebody who could find a way, but I love that it's broad-based support, and it's that you're bringing people together and keeping families together, which I think is so important.
Yeah, we get to hear, the great thing is we get to hear this from our families. Most often the caregivers, right? We're messaging with them every day. We talk to them on the phone. So we get to hear their stories from inside the home. And really what we hear is not only about how nice it is to be able to be there to connect with their loved ones, but also how much of a game changer it's been for them as the caregiver. In so many cases, these are caregivers who already are doing this type of work. They're already spending 5+ hours a day providing care. They're helping take mom to the doctor. They're helping her move from the bed to the wheelchair. They're doing all these tasks, and now it's just sort of being legitimized. And the benefits that we're hearing from them is really that it allows them to be more healthy, be more emotionally healthy. And so it's taking that stress, the caregiver burden sort of off of them. And like I said, really doing all of like the stressful work, we take that off their plate and do it for them so they can just show up every day and be there and provide the care that the loved one needs.
So we live in a society where we're information overload. We're constantly bombarded with information. So how do you advertise effectively? How do you really market what you do? Because I see this as just being a game changer across the board.
You nailed the question on its head. I think really this is an awareness sort of game here. People love this program. Givers never sells anything, right? When people learn about this program, if they're eligible, they usually say, sign me up, right? So we're not out in the game of sort of trying to sell you a product or a widget. We want to inform you about your options and the services that are available and help you get signed up if you're interested. But so the number one priority for us is really about awareness and education. So the way we get the word out is through that, mainly around educational content. When people go online and they're searching how to get paid as a caregiver or caregiver supports, they're finding information that we've produced. We also have podcasts, we do webinars, we get out into the community. And so a lot of it is sort of the ground game of making those connections and saying, hey, let's have a conversation about the services that are available to you. Because like you said, in many cases, it's really about awareness, and not only at sort of the caregiver, care recipient level, oftentimes even in the hospitals or the social workers or the physical therapists, they don't know that these programs exist. And when you're in a hospital and you're in charge of discharging a patient and making sure that they don't show back up in 3 days, what's one of the best ways to make sure that's the case? You get a family member in place and make sure that family member has the support that they need so they can provide care in the home. So I would say the number one thing we think about by way of marketing is really education.
Well, I'm so happy to have a chance to promote you, but it reminds me, so I chaired the Augusta Warrior Project for 2 years. And so it was really one of the things, it's, became the model for providing care to service members and veterans. But one of the things we found, it's the same thing, and that's kind of why I asked the question, that you've got to find the veterans and you've got to provide them the education to know what services they're eligible for. And that's not an easy task. But here again, I mean, I would hope that word of mouth with your services would spread, because it's just, it is a common ground issue, but I've been through it. Everybody I know is going through it. So I just think it's cool. I was so excited to find out about what you do.
Well, I appreciate that. Yeah. And I think at the end of the day, the same thing that applies with veterans or in any other sort of piece of healthcare is integrity has to be at the core of what you're doing. And that's why it was important to us to find people who've been in this situation themselves. So all of our employees are bought in on this mission and really thinking about how we would want our own families to be serviced. And so providing care and providing sort of high integrity care is at the core of what we do. So when we go out and educate people, or when we get people onboarded, we're thinking about really how our families we would have wanted our families to be treated, not about, sales or anything like that.
I think that's so key, as you say, integrity, authenticity. But it's like me dealing with people with being a cancer survivor now. It's like everybody that I know who has a friend or a family member that gets cancer has them call me. And you can provide, having been through it, understanding what it's like to go through chemo or, radiation therapy. It's just that empathetic link to somebody. I mean, I think that's brilliant of you to do, because you're not really providing sympathy as much as you are providing empathy, because your folks have been through it.
Yeah. I mean, I'm sure when you were diagnosed, no one handed you a playbook and said, here's how it's going to go. Here are the emotions you're going to deal with. Here's everything you're going to have to go through on week 1, week 2, right? And same thing happens with caregivers. When my family was thrust into this situation to care for my aunt, there was no playbook. There was no training, no one to tell us how things were going to work, right? So the best thing you could do is maybe talk to another caregiver and find out what their life was like. And that's part of sort of what we do. And then, of course, also as a company, we get to provide that support and that training. So there is a little bit of a playbook developed by givers. So a part of it is sort of removing the mystery around what I'm experiencing as a caregiver.
Well, and I know, it's intimidating. I had never really been sick at all in my adult life. But I'd never gone through any surgical procedures, never done all this. But it's just on any level, it's a whole lot to deal with. And, I'm young and in good health now, back in great health. But just for those, I get back to the low income families some of them, do you deal with people in the rural areas? They might not even have access to the internet.
Yeah. I mean, healthy food is an issue. There's a lot of barriers to good health in underserved areas. So the more that we can do to connect people to resources, we're always happy to. Part of the programs that we serve through Medicaid also include some other support. So, respite care is one of them, where a family caregiver can take a few days off and someone can go into the home and help them. So just give them that breath of fresh air that they need to show back up. In other cases, there's meals on wheels, or there's food that can be delivered, or there may be in-home monitoring, so we can get some technology into the home so we can know if a fall has occurred or if there's any changes in health. So some of these problems that we face are really about just the connective tissue and making sure people access the programs that they're eligible for. And so that's really what we're excited about is, hey, you are eligible for this already, and you're already providing the care. So why not get supported? Why not get paid for the work that you're doing?
Well, man, I am so impressed with what you do. I'm like, this just came at the right time for me, so I can share all this with my friends, who I'm sure will use your services. But as we get down towards the end, I always ask two questions: where can people find you?
They can go to www.joingivers.com. They can answer a few quick questions, find out what programs they're eligible for. And across the state of Georgia, we hire, support, and pay family caregivers. So we'll help them get enrolled into a government program, and then we'll provide them with the ongoing support they need.
Man, you are a godsend. But my last question is, on a daily basis, what puts a smile on your face and brings joy to your heart?
The work that I do, right? I think as any founder would say, you're pouring your life and your soul into this job. So I would say the number one thing for me right now that gives me a lot of energy is getting to provide this sort of care to everyone. I think about the experience I had with my own family, and I think about the opportunity that I had with my aunt while she was still alive to tell her about the work that I was doing as I was starting the company. And she was so excited and so passionate about Givers. And it gets me emotional every time I think about just the message that she had sent me and told me that she'd be watching over us and sort of rooting for our success. And so I feel so grateful that I had that opportunity, and it gives me joy every day to be able to further our mission.
Max, you're an amazing young man. And I believe it's leadership like yours that's going to lead our country out of the morass in so many ways and into brighter days. But you've been an amazing guest. Thank you for the services that you provide. Thank you for being passionate about what you do, because that passion is contagious. You've got me all fired up to go out and promote what you do after I get off. And I will highly promote what you do once this airs, which should be in a couple weeks. But man, thank you for being an amazing guest, and thank you for what you do.
Well, thanks for having me on, Deke, and wishing you continued good health ahead. Happy to hear you're doing well.
Well, man, next time you're in Augusta, give me a call.
Sounds great.
All right, that's all the time we've got. Dropping the mic, and we are out.
Hey guys, thanks for listening to or watching the Changemaker podcast today. Greatly appreciate it. If you're listening and you want to see the video, you can subscribe to our YouTube channel at Deke Copenhaver. That's pretty easy to remember, I would think. But really, we also want to remind you to like, subscribe, rate across all platforms, download. And if you're looking for a coach, a speaker, or anything, you know where to find me. Just email me at dekecopenhaver.com. And thanks so much for listening.